One of the most concerning things a patient can say as I'm conducting a medication history is that they're not quite sure why they're taking baby aspirin. Whenever a patient states that they are on a blood thinner, I usually ask them, what blood thinner are you on and what are you using it for? As we know now with more recent research, baby aspirin only shows direct benefit when it's prescribed for secondary prevention of stroke, meaning after a patient has experienced a stroke. The reason being is that baby aspirin is associated with higher bleeding risks, and these risks highly outweigh the benefit. This type of bleeding includes internal bleeding, which is more complicated than just the superficial bleeding that is common with blood thinners. This bleeding is more so related to internal bleeding, such as GI bleeds, which lead to hospital admissions. So if you can prevent this from happening, it's definitely recommended. I feel like this is a great opportunity as pharmacists to provide education to the patient as to maybe baby aspirin isn't recommended for them at this time, and explain to them the side effect profile associated with it if they haven't had a stroke. But most importantly, I always emphasize to talk with their doctor about it, especially if they've been on it for a long time. I thought that sharing this experience with you would make for a great MedFact Monday. I would love to know if others have similar experiences talking with patients about baby aspirin and what counseling points you bring up during these conversations. Thanks. Follow for more.